So, Andreas, just last month in September, the UN met, and there was a General Assembly, and there were some key wins for cancer that came out of the General Assembly. Can you share with us some of the more important key wins that came out of the UN's meeting?
I was at the UN meeting, and I attended two very, very important side events. One was the launching of the UN Interagency Task Force, the Global Joint Program on Cervical Cancer. You might say cervical cancer is not all cancers, but it's a very important cancer in low and middle income countries. It's hitting women. It's the number one killer among cancer in women in sub-Saharan Africa. And we have now a joint program where WHO, UNFPA, UN Women, IER, World Bank are joining UNICEF to have a joint UN coordination, and each UN contributes in the countries, in low and middle income countries, with their capacities, with their strategies to a national program on cervical cancers. This is very promising. The other UN side event I attended is not labeled cancer, but it can be also a huge push for cancer. It's called Every Woman, Every Child. This UN strategy is higher that WHO is a specialized agency, but the UN General Assembly, the Secretary General, has taken this as his priority to take care of the health of women and children. And this UN, Every Woman, Every Child, is a partnership with the World Bank, the Bill and Melinda Gates Foundation, WHO, and a couple of heads of states. And they deliver health guidance for women and children, and it is included in this cancers, breast and cervical cancer, and childhood cancer. So we have two approaches which are merging. The UN Interagency Joint Program on Cancer, on cervical cancer, and the Every Woman, Every Child movement, where there is also a global financing mechanism to fuel these strategies, is extremely promising.
So, Andreas, you know, on the WHO website, there's some very eye-opening statistics, and one of them is that it says 8.2 million people will die each year from cancer, which equates to about 13% of all deaths. This is a global number, but it says also at least 1/3 of those cancers are preventable. And it really starts with education, and you hit on it just a little bit starting at a young age, and I think some of that probably comes out of what was discussed at the UN. What are some of the other things that we need to focus on? Education, you mentioned tobacco. People start at a young age and then they can't get off the tobacco and it causes cancer. What are some of the other things that we can learn or that the WHO is talking about to prevent these cancers?
I think there is an extreme win-win, not only with cancer, but all the non-communicable diseases, diabetes, cardiovascular disease, and some chronic lung diseases, if we tackle healthy lifestyle as a guiding principle. And it's very difficult because it's very much about depending on not only individual choices, but also on the society, on the context, on the setting. In November, we will have a global conference on health promotion in Shanghai, which brings together the mayors of the cities of the world. And this is very promising because where we live is important. We have to make changes where we live. And it is not sufficient to say, look, you have to move every day 20, 15, half an hour, but you need to make it happen. It's not impossible for women in Riyadh, in Saudi Arabia, to do physical activity in public. We need to find, this is an example, an extreme example, but we need to find a setting where women, children, men can be more physically active, where they have choices in the decision-making in the market for preparing their food, have less exposure to marketing of alcohol, and have a, let's say, happy life. That's, I think it's important that we not only think about don't do this and don't this, but think about a positive aspect of this lifestyle paradigm that we have much more fun having less tobacco exposure and less unhealthy diet.
Yeah. Well, Andreas,
And we avoid, with gaining fun, we avoid cancer.
yes, absolutely,
Yeah.
a good combination.
Yeah.
Well, Andreas, thank you so much for joining me today, and on behalf of Vital Options International and Healthio 360, I want to congratulate you on all your work, and we're big supporters. So thank you very much.
Thank you.